That's all right. While we're out here, I'll have you step on the scale so we can compare your weight to the last time you were here. Great, and I'll have you follow me into the room. All right, so you've been on the diuretic furosemide, which is also the same as Lasix. You were prescribed 20 milligram tablet by mouth once a day for heart failure, is that correct?
Yes.
All right, so it's been about a week now, and I have your chart pulled up, so I want to confirm that your chart is up to date. Do you have any drug allergies?
No.
Any other diuretics?
Not that I know of.
All right, and are you taking digoxin?
No.
Okay. And now I'm going to pull up your lab results. I'm looking at your potassium levels, and it appears that your potassium level is 3.3, which is a little low. We like to see potassium between 3.5 and 5. So I will talk to your physician about possibly prescribing you potassium chloride to increase your potassium levels. And so here is a document, and it just describes furosemide and the dosage, when you should take it, how you should store it, adverse effects, and when you should contact your provider, so you can take that home and have that. But I did want to ask you a couple questions about your medication. So how has the medication been working for you?
Well, I don't really love getting up 20 times in the middle of the night to go pee.
I see. Well, how do you usually take your medication?
I usually take it with a glass of milk at bedtime.
All right. Well, that's great that you're taking it with milk or even food, because that will minimize the GI upset. But we do encourage patients to take it no later than 5 p.m., which will minimize the sleep disturbance. Have you had any difficulty swallowing your tablets?
No.
Okay, that's great. Because if you are, you can crush them, which is also listed on there.
Okay.
And then I wanted to go over some side effects that can come from taking furosemide. Are you experiencing any blurred vision, dizziness, hypotension, which is low blood pressure, or ringing in the ears?
No.
Okay. And have you noticed any skin changes?
No.
Any nausea, vomiting, or signs of anemia, which is like weakness and shortness of breath?
No.
Okay. And then we do want to encourage you that if you are experiencing any of those side effects, to contact your provider right away, especially if you're having any like numbness or tingling in your fingers, toes, or legs.
Okay.
All right. And then how are you storing your furosemide at home?
In my bathroom cabinet.
Okay. We do want to store a medication at room temperature in an environment that's not moist, and because otherwise it can change the effectiveness of the medication. So store it in your bedroom.
Okay, I'll keep it next to the recliner so I can take it in the morning with Price is Right.
Okay, great. And I want to have you demonstrate and kind of go over some of the things that that your furosemide can cause. So if you can demonstrate how to get up when you've been laying down for a while.
I'd go really slow. And then if I felt dizzy, I'd slowly stand up after sitting here for a little bit.
Perfect. And when would you contact your provider?
Oh, if I have any numbness or tingling in my fingers or toes, if I notice any rash on my skin, and then if I have a weight gain of more than 3 pounds in one day.
Perfect. And then do you know why we do follow-up appointments?
To make sure that the dosage that I'm on is correct, and to increase or decrease it as needed. And then here it says to check my labs.
Yep. Awesome. Well, I'm glad you got to come in today, and I hope to see you next time. I'll walk you out.
Great. I really need to go to the bathroom.
All
again.
right.